First, just simply, how does it feel to be retiring from Montgomery County Fire and Rescue after more than 30 years?
Surreal, because it is 35 years involved in the fire service here in the county, 32 and a half or 32 years as a career paid employee. So, that's a lot of time, and it's going to be different, when July comes and be like, okay, that's not my life anymore.
Starting from the beginning, when did you know that you wanted to be a firefighter? Was it when you were a kid?
It was. So I have no family background, no family ties and association in the fire service. 30 years ago, a lot of people joined the fire service with, uncles or brothers or family members in the fire service. I did not. I was the child, the 10-year-old plus or minus, that was obsessed with fire trucks, and I never grew out of it. So it's a service profession. We are a service industry. Different than what most people think service industry is, but you're giving care and help to people in their most demanding times and their most challenging times.
Since you started until now, what has changed in the profession?
So what we knew in the 80s and 90s was based upon many years of experience from the leaders in the fire service at the time. Now science has been able to show us what the fire does, how the fire acts. And we've been able to use that advanced science to understand what we knew then and validate that, as well as to change some of our assumptions and our understandings as to how the fire acts or reacts to our activities. So that's a great thing that has occurred. Additionally, the environment that we work in, the as-built environment, building construction, has changed. In the past, it was full dimensional lumber, 2x12 joist, plank lumber. Now we have trusses and bar joists, we have plywoods, we have a lot of lightweight construction material, and they act differently in fire when they're assaulted by fire, and they have less time for us to respond because that building burns faster, it burns hotter, and our time from fire inception to the building becoming unstable is almost about 1/3 of what it was 20 and 30 years ago.
Of course, you do deal with tragedies and situations where there is loss of life and people die. And do you think mental health is valued, in the profession? And do you think that's something that's addressed for your firefighters?
Absolutely, it is. It's gotten a much better focus than it was, 30 plus years ago when I started. One of the things I tell the new people coming to the organization is there will be days that this job is horrible. There will be those days. That's going to be a small number of days compared to the days where this job is great or this profession is great, and that they don't have the skills to deal with the horrible. They shouldn't expect that they are feeling challenged, that they don't know how to process their feelings. And they need to know it's okay to be not okay. They need to know to reach out for help. Because if they try to manage it themselves, if they try to work through it themselves and feel ashamed of their struggles with some of the stressors, that will cause greater harm to them. And one of the biggest parts about this organization is family. Our stress at work relates to our families at home. And when you don't know what that stress is, you don't know what's really impacting you, I don't want those folks relaying that stress to their home family. So absolutely, we've got more resources at play to help our members. This county does have a great amount of mental health resources for the public safety officials. And we keep seeing things that are more complicated and more challenging. Not like the other events we talked about, but our day-to-day medical calls and some of the other activities our folks deal with all the time are more challenging and difficult than they were 30 years ago. So indeed, you've got to know you don't know how to deal with everything.
Would you say that this job is as much emotional as it is physical?
By far, that's a good way to describe it, that indeed it's a physical profession, it's a physical work. But most of what we do is also about communications, about supporting and caring and having that empathy for people who are in the crisis of their life. They haven't called us just because they want something that they can deal with in other ways. They've called us because it's a true emergency.
You've lived here your whole life and now you're going across the country to Kelso, Washington. So how do you feel about that? Have you been there before and are you excited?
Absolutely excited. Absolutely been there before. My wife is from the Pacific Northwest. She came to the Washington, D.C. area from Washington State for school 30 plus years ago. And she was in disaster work like I am, and that's how we met. So For more than a minute, as we say, it's been the family plan that after Montgomery County Fire Rescue to relocate back to Washington State. And with my parents having passed about 5 years ago, I have plenty of work family. That is very important. But my family, Heidi's family, is what we're getting back close to. So that's why the move. And I've done well here, and I believe it's time to go help another community.
Would you say that this place is special to you after all these years?
It is. I was born in Montgomery County. I was raised in Montgomery County. One short stint, 1 year outside of the county, but been here my entire life outside of that. So indeed, I've seen a lot of change as the county has grown, and buildings get built, roads get changed. It's special. And it will always be that way. It'll never be, something that I disregard or that I can forget.